Tan Sri, please.
Executive Director, WHO Alliance for Health Policy and Systems Research, Resident Representative, United Nations Development Programme for Malaysia, Singapore, Brunei Darussalam, Director, United Nations UNICEF International Institute for Global Health, colleagues from WHO and the United Nations country team, colleagues from the Ministry of Health, ladies and gentlemen. Health systems are vital to maintain and sustain the population, the economy, and the livelihoods of the nation. People don't think about health system until they need it. They use the services in various ways to prevent disease, promote health, and access primary care. And for the most part, you all take it for granted. The health system gains the most attention where the experience is negative. We all hear about it when something goes wrong. For those of us responsible for the health sector, the solution is, therefore, to ensure that we have a learning health system, one that actively responds to the needs of the population, global and local health challenges, and has the human and physical infrastructure and equipment that ensures that minimizes opportunities for complaint. The health system in Malaysia has been lauded globally. It is a key reason why Malaysia was successful in its bids in 2007 to the United Nations to host the United Nations UNICEF International Institute for Global Health, or UNU-IIGH. In 2018, I was delighted to start a partnership with UNU-IIGH to produce a text that provided the opportunity for critical reflection on how we got to where we are and the tools to continue to build on the success and learn from the challenges. The systems thinking methodology allowed this reflection to occur and also provided a record of institutional memory and strengthened the capacity in the Ministry of Health and the academic community. I'm also delighted that Malaysia has been a pioneer in this holistic analysis of the health system since we became independent nation way back in 1957. Malaysia can be proud of how our health system has developed since independence. We have achieved relative success in health, and many consider our health system a model in the developing world. However, there have been great challenges and setbacks. The book takes a bird's eye view of 60 years of development, asking what worked and what did not work. It also asks the question why, looking at the interaction between factors not only among the many components of health sector, but also in others, such as the community, its composition, aspiration and value system, education, economy, politics, communication, and also international events and relationships. The analytic process has brought several benefits. From Malaysia's perspective, we gain insight into critical elements in our past development and better appreciate our strengths and limitations. The process allowed frank and reflective discussion between public, private, and academic experts who often do not have such opportunities. The authors, editors, and contributors brought a wealth of personal, historical experience and great literature to those discussions. Their differing perspectives viewed through a systems thinking lens brought into sharp focus the fault lines and the pressures that create and sustain the challenges in today's health system. It has been a highly beneficial mutual learning process. The book analyzes the interactions between the various components within our health system, namely the primary, secondary, and tertiary services, laboratory, pharmaceutical, and engineering of environmental health services, human resources, information, governance, and leadership. It also analyzes the interactions and influences between health and other systems, the people, for example, their composition, aspiration, and belief, the economy, the politics, education, and communication. The book includes Malaysia's historical success in dealing with engineering diseases of environmental recent epidemics like SARS, human resources, Nipah virus, and governance outbreaks such as measles. It also analyzes in the analysis and the storyline is that links within the public health system, the people are largely strong, composition, mutual aspiration, and belief. But link economy, interaction, politics, the private sector, and other sectors external increase Malaysia's historical success in dealing with continuous nurturing environmental recent epidemics. This book was completed in early January 2020. Governance before Malaysia and the rest of the world. It also analyzes the analysis and the storyline is that therefore the book does not cover the people are largely strong. However, the analysis in the book largely less in interactions with the private sector and other sectors. Our health system was able to realize historical success in dealing with continuous nurturing environmental recent. This book was completed early January 2020. Governance before Malaysia and the rest of the world. It also analyzes the early stages in the storyline that all the book does was positive and large and strong. However, the analysis challenges during the book largely certainly demonstrated that several spotlights of health system were able to realize historical success in dealing with continuous nurturing environmental recent. This book was
Can I ask anyone who has not muted themselves, please, to mute themselves? There seems to be an echo in the playback. Our apologies, please, a bit of a glitch. We will try again and start possibly from the halfway through. Nadia, if that is possible, please.
brought into the fault lines and the pressures that create and sustain the challenges in today's health system. It has been a highly beneficial mutual learning process. The book analyzes the interactions between the various components within our health system, namely the primary, secondary, and tertiary services, laboratory, pharmaceutical, and engineering of environmental health services, human resources, information, governance, and leadership. It also analyzes the interactions and influences between health and other systems, the people, for example, their composition, aspiration, and belief, the economy, the politics, education, and communication. The book includes Malaysia's historical success in dealing with communicable diseases, including the recent epidemics like SARS, the Nipah virus, and the emerging outbreaks such as measles. As told in the analysis, the storyline is that links within the public health system are largely strong and mutually supportive. But links and interactions with the private sector and other sectors external to but deeply influential on the health needs continuous nurturing and development. This book was completed in early January 2020, just before Malaysia and the rest of the world began to face the COVID-19 pandemic. Therefore, the book does not cover the pandemic period. However, the analysis in the book largely bears out of our experience in the pandemic. our health system was able to gear up rapidly in the pandemic's early stages, engage with all of government and respond relatively and effectively. The challenges during the more recent pandemic stages certainly demonstrated the several fault lines that we and most other countries struggle with continuously. The most prominent of this is the difficulty of policy making and leadership in conditions of uncertainty. The uncertainty is particularly daunting when it involves both inadequate and rapidly evolving scientific information about the virus and its behavior, and uncertainty on how humans and communities behave and respond when faced with an unprecedented threat. The value of the system thinking approach in Malaysia is worth noting, and it is gratifying that this example sets the stage for others. I'm delighted to be sharing this platform with the WHO Alliance for Health Policy and System Research with the United Nations Development Programme. I hope this book will be useful to policymakers and academics worldwide, particularly in the Global South, to understand these challenges and develop adequate responses. Furthermore, I would recommend that engaging in an analytic process such as this would be a good learning process for staff in every type of healthcare system. With that, ladies and gentlemen, I thank you for your attention.
Thank you very much for those very kind words about the book, and thank you so much for your support all through this process. It would not have happened without it. I remember when it all started at the World Health Assembly in 2018, and you were always gracious about it. You always put your commitment 100% behind it, and supported your staff's time to engage in the process with us on the production of this book. So it's truly, thank you very, very much. We have a very short gimmick that officially signifies the launch. And then we will go straight into some very exciting panel discussions and presentations. Nadia, please. Thank you very much for that. So with that, given we can't physically be together, that is the official ribbon cutting, virtual ribbon cutting for the launch of the book. I'd like to just take a few minutes to particularly acknowledge all the authors and contributors to the book, but particularly to Dr. Indra Padmanabhan, who had the energy, amazing energy, to drive the process, supporting us from UNU-IIGH. And also would like to acknowledge Dato Maimuna Hamid as well, who at the time was on our scientific advisory board as well, and was incredibly supportive. The Ministry of colleagues from the Ministry of Health couldn't have been better, totally enthusiastic, including those who were involved in the development of the Ministry of Health. I don't know how many years ago, all came together Dato Anwar Zaini, and so on. I don't want to start mentioning names. They are all listed within the book. What we're going to do for the rest of this afternoon is provide a little snippet of the text, but also focus very specifically on the critical use of systems thinking in our health systems and in fact in other areas of international development. I will hand over the next part of the program to my colleague from the WHO Alliance for Health Policy and Systems Research, Dr. Kabir Sheikh. Kabir has worked as a public health researcher, educator, planner, and practitioner in a career of over 17 years in India, Australia, UK, Bangladesh, Tanzania, Zambia, South Africa, and Belgium. His particular focus has been on strengthening health governance for social equity, institutionalizing research use for policy, and advancing the field of health policy and systems research. Thank you very much, Kabir, for taking the time to be a part of this process, and over to you now for the next part of the program. Thank you.
Thank you, Pascal. Many thanks for that kind introduction, and a very good morning, afternoon, and evening to all those present. Really struck by the opening remarks from the DG, very thought-provoking round of initial remarks, and I think it's really set up today's session for a substantive discussion, and we hope we'll actually get some exchange and with the audience as well. It's my pleasure to chair this next part of the session, and I'd like to start by sharing some initial thoughts about the book and why it's a significant step in advancing systems thinking for health systems, but also more broadly with lessons for international development, as Pascal has pointed out. So the book presents a case study of a country, that's Malaysia, that's going through a very significant and remarkable story of economic transition. It highlights the social functions of health systems and also the political economy underlying decision-making. It's practical and comprehensive, and it covers themes from traditional medicines to digital technology. But most importantly, out of all of these things, it presents transferable lessons for other countries. In this post-COVID environment, we've seen a rising interest in health systems and consequently also an upsurge in investments in health system strengthening, which is very welcome. Also somewhat overdue, as the DG also remarked on in his opening speech. However, at the same time, it's important to remember that investment in health systems is not automatically investment in systems thinking. It's still possible and also quite common to actually invest piecemeal in a part of the health system without due reflection on or addressing the effects on other parts of the same system. So recognizing this complexity and interdependencies within health systems, which is the contribution of systems thinking, has been an important step, not just in understanding the health systems, but unfortunately it can create what could be described sometimes as a complexity paralysis. So appreciation of complexity should not be seen as an impediment to action. And this is the critical opportunity for us systems thinkers to show to people that there is a way forward in this complexity. And systems thinking is the antidote to this complexity paralysis. And this is one of the key achievements of this book, in being possibly the first major and well-documented application of systems thinking at the national level. And for that, both personally and on behalf of the Alliance, we convey our compliments and congratulations to the authors and to the United Nations University Institute of Global Health. At the Alliance, systems thinking has been a major focus for us, and it became engraved into our DNA when we launched the Systems Thinking Flagship Report in 2009. We like to think that we are systems thinking evangelists. We are very happy to join hands with UNU, with the government of Malaysia, others represented in this session, the Asia Pacific Observatory on Health Systems and Policies, UNDP, and of course others on this platform and beyond to take forward this systems thinking movement. We still think it's nascent and neglected ultimately in the mainstream world of health systems, so there's a lot of work to do. I'd also like to just point out one key example of systems thinking and systems-wide interventions, which is a focus on learning. And at the Alliance, we believe that learning health systems is an important next step that draws on and builds on systems thinking principles with clear practical applications. We launched our most recent flagship report on learning health systems last month, and I'll try and present some of those ideas during the panel discussion later in the session. But for now, it's my pleasure to introduce the speakers. And the first speaker is going to be my colleague, Dr. Aku Kwame, a technical officer at the Alliance for Health Policy and Systems Research. She is a health systems researcher whose work has focused on applying complexity theory to health systems governance, management, and leadership. She's particularly interested in district health systems. She leads our portfolios on systems thinking and capacity strengthening. She's a next Einstein Fellow, Commissioner on the WHO UNICEF Lancet Commission, and a working group member for Children in All Policies 2030, and a former board member of Health Systems Global. And Dr. Kwame is going to talk about systems thinking at the Alliance. Over to you, Aku.
Thank you very much, Kabir, and good afternoon, good morning, and good evening, colleagues. Allow me to add my words of enthusiasm to all of the authors for this great contribution. We are absolutely excited to see the launch of this book today and what it adds to systems thinking. I want to take a few minutes to very briefly introduce what the Alliance has been doing in systems thinking to push this field forward over some time. Let me start just by reminding us what the mission and the mandate of the Alliance is. We work primarily in low and middle income countries to support the generation and use of health policy and systems research as a means to strengthening health systems in those countries. And we have three main objectives in our new strategic plan period from 2021 to 2025. First, to support the generation and synthesis of policy relevant knowledge for health systems. Secondly, to support the dissemination and the use of that knowledge. And thirdly, to support capacities for researchers, for policymakers, and for other stakeholders as well. Now, briefly, I want to build on some of Kabir's comments, just reminding us of where we've been in the Alliance focusing on systems thinking. Many of you are probably familiar with our flagship report from 2009, which was really an important report in the sense that it introduced systems thinking to us for health systems strengthening. And it was really the first time where there had been a concerted platform to try to import some of those ideas of systems thinking that had been used in other fields and see how it could be beneficial to thinking about health systems. In 2012 and 2014, we also supported the development of two special issues looking at systems thinking again for health system strengthening. The first supplement really focused on strategies. What are the strategies that can be used to support systems thinking, and really took a global view. In 2014, we looked for examples in low and middle income countries where systems thinking tools or methods or approaches had been used. And it's notable that even with that supplement, there are still limited examples. And so this is why the book that we're launching today is so exciting. There is still very much a need for exemplars of how countries are using systems thinking in practice. Now, the work that we've been supporting over the past few years, in 2018, we started looking at using systems thinking to support districts, health managers in their routine tasks to use systems thinking. We've been working in three countries, in Timor-Leste, Pakistan, and Botswana, working with local research teams as they cascade down tools to adapt for district managers. And it's been quite interesting to see that in those countries, they've been able to use the approach to systems thinking with tools, marrying that to a reflective practice process, and actually engage in the use of those tools. In Pakistan, it supported the contact tracing related to COVID-19. In Timor-Leste, it's been supporting the vaccination rollout. And in Botswana, where there have been several district level reforms, it's supporting the district teams in trying to navigate the coordination challenges that they face. We've also been working with colleagues at the Swiss Tropical Institute, Public Health, to support those teams in developing research, embedded research, and also allowing for cross-country exchange. Last year, we also put forth what we were seeing as some of the key issues that will be part of today's discussion around why, given the fact that we all agree that systems thinking is useful, we still don't see it in practice the way we would like to see it. And in the commentary that we published last year, we point to a few factors that we think might be the issue. One around a challenge of terminologies, that we've been a little loose in our language and we've used systems thinking sometimes interchangeably with health systems. And what we need to do is actually build up more theory, bring in systems thinking theories, complex adaptive theories, to help support the building up of evidence. The other thing that we put forward in this, the other argument in this commentary, is also the fact that systems thinking perhaps has been plagued by being considered as still too conceptual and therefore has not been used both in policy making and in practice. And there is a need to practice systems thinking with all the challenges and the time that it takes. We've also produced earlier this year, a 5-episode podcast, which explains some of these issues as well. Now, growing out of the work that we've been doing in districts, we've been engaged in the past year developing what we've been calling the Systems Thinking Accelerator, or SYSTAC. And we've been seeing this as a venue that has 3 main objectives. The first is that we're seeking to build a platform for systems thinking to increase both the science and the practice of systems thinking in health policy and systems research. And we really want to support the exchange of ideas and knowledge from countries. The second is to build a global community of practice that is engaged in systems thinking tools and methods, that is refining some of the terminology and the definitions around systems thinking. But really, we are desiring to convene and capacitate a critical mass of people who are oriented towards systems thinking in their health systems work. And finally, we seek to be an amplifier to promote and advocate for greater use of systems thinking, particularly in LMICs and particularly in an applied way. So we've been working with 5 regional institutions over this time in Costa Rica, in Ghana, in Switzerland, in India, and in Philippines. And we've been working still with our friends at the Swiss Tropical and Public Health Institute to try to develop some regional work, and this has really been formative. In India, it's the George Institute that we've been working with Devaki Nambiar and colleagues there. In the Philippines, it is the University of Manila with Kathy Reyes and colleagues there. And the work that they've been developing over the past year has been conducting regional assessments for systems thinking. What is the awareness? What are the capacities? What are the needs? And engaging in regional activities. So the colleagues have been running regional workshops. The colleagues have been engaging in collaborative work to think regionally, what can systems thinking add to some of the issues that are being faced around primary healthcare, around equity. And of course, the team from UNU-IIGH has been involved in that thinking as well. We've run capacity webinars. We've established an online platform that currently has about 60 members. And we have a special issue on applied systems thinking coming forth in the next year. What we are excited to announce, and this is my final slide, is that we will be having a global meeting in early November on the 2nd and the 9th, where we invite all of you to join us as we continue to think through. This is now really the beginnings of this community where we want to think together. We want to develop collective theories of change around systems thinking. We want to document examples of where systems thinking is taking place. So you can register and get more information on our website, and we look forward to taking those conversations forward. Thank you very much. And Kabir, back to you.
Many thanks, Aku, and for that very succinct and clear presentation. And let me move on to the next speaker now. That's Dr. David Mccoy. David Mccoy will shortly be joining the UNU-IIGH as the research lead in translating evidence into policy research. Dr. Mccoy is a medical doctor by training. After 5 years of clinical medicine in England and South Africa, he moved into the broader field of public health and spent 10 years working in South Africa, where he supported the post-apartheid transformation of the country's health systems. On his return to UK, he worked variously as a public health practitioner and academic. He's a former borough director of public health in London and I'm a former director of the UK-based charity MedAct. A pleasure to have David on this panel. Over to you, David, for your presentation.
Great, thank you so much, Kabir. I hope everyone can hear me and that you can see my screen. Firstly, can I just say it's a great pleasure to be here at this launch of this book, and it's also been a great pleasure to have been part of this book. I had a relatively minor role involved in 2 of the chapters in this book. And first thing to say is that this book is so rich. There is so much to draw from the analysis. But what I'm going to try and do is just to kind of focus attention on 3 topics. And I see these 3 topics I've taken out from the book as being hopefully quite generalizable. So I'm not going to be speaking so much specifically to the Malaysian health system, but rather to kind of talk about some of the reflections from this analysis that may be generalizable and broadly applicable to other health systems. And these 3 topics are firstly, making a point about the explicit historical emphasis of this book. The second point is to draw out some comments about financialization. Financialization, I think, is a really important contemporary health systems driver that deserves much more policy and research attention. And then finally, I want to speak about WHO's health systems framework, their well-known building blocks framework, and present some of the thoughts that we had in the book about how this building blocks framework can be developed and improved for future health systems research and analysis. So just in terms of the first point, I think one of the most interesting aspects of this book is its historical account of health systems development, going all the way back to the 1950s at the moment of Malaysia's independence, and describing how this health system in Malaysia developed and evolved, both to respond to the various social, economic, and technological transformations that have occurred in society, but also describing how those transformations themselves have influenced the health system. And you can see, for example, the evolution of health systems in Malaysia, going from a primarily state-based a process of health systems development that was primarily led by the state, through a process of planning and management with a supply-led strategy that was informed by public health research and analysis, with the Ministry of Health being very much in the driving seat. You can see the manner in which health systems development was also part of the nation-building exercise, something that is quite common to many other countries, that kind of initial post-colonial phase. And you can see the success story that this also represented, with rapid rises in healthcare coverage, reductions in mortality, and improvements in life expectancy. That was the 50s, 60s, and the 70s. But you can see now in the more recent period that the process of health systems change and development is much less a supply-driven approach, and there's much more of a demand-driven approach to health systems change. And instead of the Ministry of Health being the key driver the key driver of health systems change and development, we see other actors and forces shaping the way that the health system evolves. And in particular, we see the growing role and importance of market forces, and the way in which private actors are also extremely influential in the way that health systems evolve. This too is a phenomenon that is common to many other countries, and it's partly driven by the effects of globalization and also the rising levels of mobile finance capital that flow across the world. Which of course brings me to the second topic that I want to kind of bring out. A simple but useful definition of financialization comes from Epstein. And this is really a term used to describe the increasing role of financial motives, financial markets, financial actors, and financial institutions in society. Now, this is a phenomenon that cuts across all sectors in society, but one that also affects the health sector. And this table provides some data which I think helps to describe why I think, why I think financialization is an important topic to understand. The data that is particularly important is in the third column here. And what it shows here is the way that we can see this growth of financial assets relative to population growth and GDP. And it kind of provides an indication of just how important financial assets have become in society in shaping policy and shaping the development of a variety of sectors, including the health sector. You can also see here data about the debt stock, which indicates or kind of illustrates that much of this is driven by the creation of debt in the financial system. I think financialization of the health system in Malaysia is also interesting because although much of the capital, finance capital that is shaping society is private in nature, some of it is also public. And the financialization of the health system in Malaysia is particularly interesting because much of it is also driven by the use of sovereign wealth funds and the role of private hospitals that are wholly or partially owned by government-linked corporations. So this is an area of research and analysis I think that could be not only important and useful for Malaysia, but also something of importance for people working in health systems research more generally. The third topic concerns WHO's well-known and famous building blocks framework, which is represented here. You can see on the left the 6 building blocks of the health systems framework and how these building blocks come together to enable accessible healthcare with good coverage, quality and safety, producing outcomes in terms of health improvement, responsiveness, social and financial risk protection, and improved efficiency. Now, while this framework was really helpful in shaping the research and analysis for this book, we made 3 suggestions as to how it could be expanded and improved. The first suggestion was to consider explicitly labeling the 6 different building blocks in terms of their particular characteristics. So we pulled out 2 of those 6 building blocks and described them as being foundational building blocks, 3 as being operational building blocks, and then the final building block as being really the kind of key delivery building block or the outputs of the system itself. And we also emphasize the important interrelationships and the bidirectional interrelationships between these 6 different building blocks. So we feel that this might be a more useful way of characterizing the 6 building blocks. The second suggestion we had was to highlight and explicitly recognize the fact that health systems also play important social, cultural, and economic functions. And that there should be much more thinking about how we can develop measurements and indicators to be able to measure the performance of the health system in terms of these social, cultural, and economic functions as well. So that we look at the health system as being more than just a mechanism for the delivery of healthcare services. And then the final suggestion was to say that while these 6 building blocks make a perfectly good framework for thinking about health systems, they fail to bring out one of the most important dimensions of any health system, which is how the health system is constructed in terms of the role of the market and the degree to which the market is regulated, and also the way that health system is constructed in terms of the mix between public and private actors. When we think about the mix between public and private actors, we're thinking about that mix both in terms of the function of governance and stewardship, the function of financing, and then also the function of healthcare provision. So that's the end of my presentation. And I hope that was useful, and I look forward to hearing people's comments and reflections on what I've just presented in terms of those three broad topics. Thank you very much.
Thank you, David, for that very thoughtful presentation. I think excellent illustrations of the need to look at cross-system phenomena and why that's an important element of systems thinking that bears greater application. I think the medicalization, financialization, and then you identify the building blocks which are more foundational in nature, and why analysis of these cross-cutting phenomena is potentially more valuable than of independent phenomena within the health system, but also that we need to think about the interventions that follow, and those also must necessarily be cross-systemic. Very useful, and I hope that will spur our conversations later today. I'm going to hand over now to Professor David Tan. David Tan is the head of experimentation at the United Nations Development Program Accelerator Labs, the UNDP Accelerator Labs, where he works on a wide range of sustainable development challenges to enhance learning, integration, and the localization of the SDGs. Before joining UNDP earlier this year, he spent 4 years as a policy researcher at the UNU Institute of Global Health, where he worked on systems thinking, complexity science, interdisciplinary research, health systems, and implementation research. David is going to be talking about systems in health and development, reflections from the COVID-19 pandemic in Malaysia. Welcome your remarks, David, over to you.
Well, good afternoon, good morning, good evening, everyone. And thank you very much for the introduction, Dr. Kabir. As you mentioned, I will be providing a brief reflection on the interactions between health and development from the COVID-19 experience in Malaysia. I want to start with a newspaper opinion piece that appeared in January this year, at a time where daily new cases of COVID were around the 2,000 mark. One opinion writer suggested that Malaysians would need to behave as if there were 20,000 new cases daily if we were to contain the pandemic. Less than 7 months later, Malaysia breached 20,000 daily new cases. Fortunately, the vaccine rollout came into full swing shortly after, but not before the health system was stretched to capacity. Like many other countries in Asia, Malaysia was initially very successful at containing the COVID-19 pandemic. And various experts have suggested that the previous experiences of SARS and the swine flu helped to prepare health actors as well as to shape the mindset of society at large. The response of the social welfare system was also important in enabling many to comply with movement restrictions and to stay away from work for a time. Of course, it's not possible to contain a virus like COVID indefinitely. The goal was to hold out for a vaccine. And there are systemic pressures that limit how long a containment strategy can be successful. There are societal pressures to return to normalcy, to be with friends and family. There are economic pressures from businesses and workers alike. And because COVID-19 spreads exponentially, a small gap in containment can generate large consequences. So what happened in Malaysia? Here are some of the pivotal factors that contributed to the spread of COVID-19 here. A political crisis resulting in state elections in the state of Sabah and the election campaigns, in-person campaigns that took place as a result. There was incubation of COVID-19 among migrant workers especially, who lived and worked in crowded conditions. There were disagreements between government ministries and disagreements across society about how best to handle the trade-offs between health and economics. And inequities in the global vaccine distribution system delayed vaccine access to low and middle income countries. These stories are not unique to Malaysia, but were repeated in some fashion in country after country. And we think about these, we find that the limits in our ability to contain COVID-19, while many of those limits were determined by factors beyond the health system. What then are health system actors to do? Building interfaces may be one of the most important tasks as we seek to improve health outcomes. One example was the Malaysia Health Coalition, which represents 51 different health profession societies in Malaysia. And in the early months of the pandemic, it developed messaging on COVID-19 in 29 languages and dialects. And it wasn't just translations, they specifically targeted the messaging toward the demographics of the various language groups. They were able to do this because their members had pre-existing interfaces with rural and migrant communities who played a crucial role in refining these messages and disseminating them. Likewise, interfaces were critical for implementing the whole of society responses needed to contain the pandemic, including messaging, welfare distribution, compliance and enforcement of standard operating procedures, vaccine distribution, and more. The resilience of governments and societies, especially in times of crises, depend on the strength of these interfaces. Where pre-pandemic interfaces were weak or where they had to be constructed on the fly, friction occurred. Government authorities initially attempted to centralize all distribution of aid, whether from public or private sources. And civil society organizations were frustrated because many believed they were more agile and better connected on the ground. An interface had to be constructed. And because the public and private health sectors in Malaysia have had limited collaboration in the past, there were communication and coordination challenges when trying to bring aboard private health sector actors in the vaccination effort. A key lesson to draw from this is that interfaces that we have in normal conditions are the interfaces that we will have when crises hit. So we need to work out what interfaces we need to create resilient systems and figure out how to build, maintain, and use these interfaces in ordinary times. As UNDP supports governments and societies in building back better, strengthening interfaces for integrated socio-economic solutions that reaches the most vulnerable is central to UNDP's Offer 2.0. Indeed, one of the things that the UNDP is working on with over 50 governments is on an integrated national financing framework to align the COVID response to the Sustainable Development Goals. UNDP is also working with the private sector on a wide range of partnership initiatives to build the system necessary. The UNDP country office in Malaysia, along with many other parts of the UNDP system, have also been contributing to the conversation about the global interfaces needed for vaccine equity. So how can the interface in health systems and development systems be strengthened? This diagram from the book publication illustrates how the health system sits within a larger social economic system. We have traditionally thought about the functions of the health system as a service delivery component, including medical products, technology, and human resources, and the back end required to support service delivery, that is leadership and governance, financing, and health information. However, we know that the state of the environment is a major driver of human health, whether we're talking about communicable or non-communicable diseases. Health systems have engaged on this social ecological environment, in particular on tobacco and alcohol use. And the health system in Malaysia was instrumental in driving the development of rural water and sanitation in Malaysia. And the COVID-19 experience just drives home the point that health system actors need to interface with other parts of government, with other parts of society, because health is driven by social and ecological environment factors. And just as health outcomes are shaped by factors outside the health system itself is also shaped by human health and well-being, and how governments and societies interpret these outcomes. David Mccoy talked so much about the financing and how that is shaping health systems today. The COVID-19 pandemic is also playing a role in changing the state of our cultural paradigms, our collective beliefs about what government, society, and the world should look like. The pandemic experience is influencing what society thinks about health systems, including belief in vaccines and public healthcare, trust in health authorities, opinions about healthcare financing, and much more. And there's no guarantee that we will learn the right lessons. One narrative that has arisen out of this crisis is that there is a conflict between health and the economy. Now, we don't think that's true, but health system actors need to communicate narratives that advocate for the integration of health and development and how they support one another. One way UNDP in Malaysia is engaging the public on narratives of health and development is through the publication of Cari Makan. And this is going to be on our UNDP Malaysia's Singapore and Brunei Darussalam repository tomorrow. Cari Makan is Bahasa Malaysia for looking for food or making a living. And the publication explores the pandemic through the stories of 6 different personas, bringing the Sustainable Development Goals and their interactions, including health and well-being, turning them from abstract concepts and data points into lived realities that our readers will readily recognize. Additionally, UNDP in Malaysia, together with the Regional Bureau of the Asia Pacific Strategic Foresight Network, is working on mainstreaming foresight and anticipatory governance. Foresight uses a variety of tools, including systems thinking, to create narratives that help us anticipate the future and act proactively. And anticipatory governance is about implementing foresight in institutions and organizations, which once again requires building and strengthening of institutional interfaces. I want to close by returning to the opinion piece I started with. The author understood something critical. In order to change our present behavior, we need some way to experience the future, so its consequences are real to us. As we work toward the SDGs and as we seek to integrate health and development, we need to develop collective understandings and narratives about systems of health and development, how they interface with one another, and the futures they produce. The extent to which we succeed in doing this will shape our capacity to build sustainable and resilient futures in which we secure human and planetary health whilst achieving sustainable and equitable development. And systems thinking is necessary to this work. Thank you very much.
Thank you, David. Very valuable interventions and really expanding the scope of the discussion so far beyond the health sector and into other areas of development. In the interest of time, I'm going to hand over to our moderator for the next part of this session, Dr. Nima Askari, who's the director of the Asia Pacific Observatory on Health Systems and Policies. Dr. Askari joined the Secretariat on 10th October 2016, and he has 20 years of experience working in public health development and health systems, focusing on strategic planning and coordination of development across multiple partners. Over to you, Nima.
Thank you, Kabir. Good morning, good afternoon, good evening, everyone. Just want to echo what everybody else is saying and thanking the UNU-IIGH for organizing this and inviting me to try and moderate this session. And congratulations on the publications of the report. So for what we have heard is 3 different aspects of system thinking, from the work that the Alliance is doing in actually to promote system thinking, to the book itself and the ways that they are using this in different parts of the health architecture, from the historical aspects of financing to like service delivery issues and the 6 building blocks. And we've also had David Tam, who's trying to move this beyond the conversation, beyond the health, put health in a wider societal and wider government structure. I am waiting for questions to come in, but while we are waiting, I have a couple of questions that I think we could start the conversation. The panel today is, we have 3 people, very distinguished people. We have Kabir, which you know, and Pascal. And we also have Mr. Niloy Banerjee, who is the resident rep for the UNDP in Malaysia, Brunei, and Singapore. So let me start with, and I'm going to put Niloy on the spot. So contrary to original program that we had, can you do some reflection on your thoughts when it comes to system thinking, which goes beyond health? So let's expand, and then if that's necessary, we can contract and come back to it. But let's start with the wider issues and see if what are your thoughts, your reflections on applications and use of system thinking when it comes to issues beyond health. Over to you, Niloy.
Thank you, Dr. Asghari. Give me a heads up if you can hear me. Give me a thumbs up if you can hear me. All right, perfect. Look, thanks very much, Pascal. Congratulations on this labor of love, David, Dr. Kabir, Dr. Nima, Dr. Kwame, all of you, Dr. David Mccoy, all of you for this wonderful labor of love. Listen, very quickly, UNDP has this mandate of working across the SDGs. It's not a sectoral agency. It's deliberately programmed not to be a sectoral agency. So WHO, UNU, ILO, UNICEF, all our sister agencies have very strong sectoral mandates. Ours is to meta this. And therefore, I think that's where the whole sort of systems thinking comes in for us. So Dr. Nima, this is where we find the systems thinking. We have trade-offs between environment and livelihoods. For example, we could in Malaysia alone, where I live and Pascal lives, we could flatten out all biodiversity. It's one of the most biodiverse countries in the world. We could flatten out all biodiversity and devote it to income and growth, which is goal 8 of the SDGs. Or we could just preserve biodiversity, which is goal 15. So sometimes the goals, the SDGs are not mutually reinforcing. There's trade-offs, and you have to make policy choices, investment choices, where government goes with each of these. So it's all the same, exactly as all of you have spoken, Dr. David Tan has spoken. This pandemic showed us there are trade-offs. Do you let people go out and get infected, or do you let people go out and do their jobs and earn their livelihoods? I mean, it's we face these trade-offs on a daily basis. Energy and jobs, climate change and jobs, biodiversity and growth, infrastructure and sustainable consumption. So it's all mixed in. So it's all of systems thinking, all of government thinking, all of societal thinking, trade-offs, winners and losers, stakeholder analysis, and therefore the political economy of development. So it's this is a hugely important area of scientific work. What we do anecdotally and boots on the ground, you are bringing into a scientific framework, which helps us take it through to the next level of solution seeking. Over to you, sir.
Thank you very much. So a more pragmatic, as you say, boots in the field approach, which needs to be linked or is linked to the more structured, let's say, system thinking approach, which brings out the consequences. Let me build on this and ask Kabir. In health, can you give us some more? I mean, there are some good examples in the book, but can you give us some more examples from outside of Malaysia or outside of the area of necessarily Southeast Asia or South Asia, when we are looking about the examples of health, examples of COVID recovery, when it comes to using analytical approach and systems thinking?
Sure, Nima. At the risk of having already spoken a lot on the panel and taking up a lot of time, but let me, in 2 or 3 minutes, let me just try and encapsulate one key area that I think really captures this, the sort of next steps for systems thinking in the context of the health system. So at the Alliance, our mandate is to work on strengthening health systems in low and middle income countries. And within that scope, there's a quest, a specific quest for cross-systemic perspectives and interventions, because we recognize that change doesn't come piecemeal. The most significant shift that we've made in recent years has been to advance this focus on learning. So learning health systems really builds on the foundational principles of systems thinking. So we all started in 2019, before the pandemic, when we convened a meeting of low and middle income country-based policymakers and experts. And the consensus there was that learning is, first of all, of course, a critically important area, but also a neglected area in health systems. When you see the building blocks, we don't really see learning there. And also that many health systems currently have a learning problem. So they don't learn. There's too much recidivism. We don't learn from previous experiences. Then what happened that soon after that, the pandemic struck, and it really reinforced that understanding. Systems that actually did learn from previous experiences did much better in the response. Often, they didn't do better later on, but there were no country has really done very well to deal with COVID, but there have been instances of success which have been drawn from previous learning. So in response to that, we developed a whole work stream, and I think we are in the process of developing that, engaging partners. We really welcome everybody to join that effort. So we launched a flagship report last month. The key lessons coming out of that: learning is cross-cutting, occurs at all levels of the health system, from the individual level to the team level, organization, cross-organization. Second, and I think this is crucial, learning improves specific functions of the health systems, which are the mandated functions of the health systems. But it also has cross-system benefits. So these are improving adaptability of the health system overall, resilience, what people call resilience, adaptability. It improves innovation potential within the health system. Innovation, much misused phrase, but in the context of health systems, I think it takes on a whole different character. And ultimately what it does, especially in the world of transitioning from external to domestic financing, it increases the self-reliance of health systems for intellectual leadership and capital within that health system itself. So classic example, you asked for an example, classic example, sorry, I'm not going out of the region per se, but we can't move away from Thailand. How developing learning systems has improved adaptivity as well as self-reliance. So Thailand's preparations for universal health coverage reform started in the 1970s, and they are still evolving. So you see that is long-term planning. Early in the process, they invested in health systems and embedded research capacity within the ministries. The reforms are led by the politicians, but shaped very much by those analysts. And what's happened now over this period of time, we've seen that UHC has been implemented, scaled up over several decades, and Thailand has achieved a high level of financial protection, improved equity in the use of services. But in doing so, it's also become much more self-reliant in its learning needs, because it's developed that individual and institutional capacity. And that brings me to the third point, which is that the task of building the learning health systems entails these, again, systemic cross-cutting changes, from institutionalizing learning throughout all aspects of the health system to developing and using the relevant human capacities for learning more effectively. Many examples of those from across the world, but I'll hand over back to you because we don't have much time.
Thank you. Some very fascinating examples, and Thailand as ever comes up when he's talking about these things in Asia. I have a question from the floor, and this is open to everybody, but Pascal, feel free to jump in first if you want. Health system contribution to health improvement in health status is about 20%. Surely the endpoint in systems approach should be to look at interrelationships with other systems, using population health approaches as an example. Any thoughts on this? It's statements, really, I suppose, the questions. So what we're talking about is that, if the health system has only got 20% impact on the health improvements, how can we then link it to the other aspects How can we look at the other factors when it comes to improving health? Over.
I'll have a stab at it, but then I think I'll open it up to the panel as well. For me, everything is a teachable moment, and I will just use it as an opportunity to push again the systems thinking approach, the analytical approach that it offers us. That in fact it does what this whole exercise has done is actually to demonstrate that it is possible to bring together all of these different areas as part of thinking about the outcomes that we want. So yes, it may be that we start off, and it continues actually to be a problem that people within the health sector focus on the health sector, sometimes out of habit, because this is what we know. But increasingly, I have to say, do recognize that they do need to move outside of the health sector in order to engage better, to improve our health outcomes. And clearly the population health approach also offers something different, but not the full answer. So I think that what systems thinking does allow us to do is to interrogate all of these different aspects to actually think about what comes together for the optimum outcomes. For Malaysia in particular, if that is the question, I think thinking about the book, I would direct the question to probably the two Davids, either David Tan or David Mccoy, to have a stab at it as well.
David? You're both muted, by the way.
All right, I'll take a quick stab at it, and then I'll pass to David Mccoy. As I mentioned in my presentation, interfaces are really, really critical if we are going to achieve systemic action. And one of the challenges is we can work on great systems thinking analysis within our own sectors. And we can even do an analysis about how our sector interacts with another sector. But until we do that with partners in an interdisciplinary way, we're going to just create narratives that the people that we need to work with don't buy into, don't understand, they don't get it. I'm trained not as a health professional, I'm trained as an engineer. And UNU-IIGH brought me in because they wanted to look at the intersection of health and engineering and urban planning. And that was how I got into health systems, and was able to dialogue between the two fields. And we need more of this kind of work, more of people traveling between different sectors, different areas of work and development. And we need to be very deliberate in building interfaces, not only to face a crisis, but we have to ask, what are the interfaces that we need in future crises? How do we operationalize them now in a way that makes sense already? David Mccoy?
Thanks. Just 2 points to add, really. Going back to the question that you posed, Nima, I absolutely think that health systems need to be studied, understood, analysed in terms of, their wider impact. That it's what I was saying earlier about thinking about social, economic, and cultural outputs and outcomes. That when we judge the performance of a health system, we shouldn't just be thinking about its ability to deliver on healthcare services. And when we think also about climate change, global warming, biodiversity, we should be thinking about the role that health systems play in relation to the environment and the ecological crisis that we face. So that would be one thing. We definitely need to be looking out of the box of the health sector itself. The second point I want to say about systems thinking is that I sometimes get nervous about systems thinking in the sense that it can reinforce the very technocratic approach to our understanding of health systems. It's almost kind of creates this engineering mindset that the health system is something mechanical that we can kind of manipulate using that kind of engineering and technocratic mindset. But we all know, of course, that health systems are highly socialized, they are highly political, and that there are also areas in which we have different interests contesting with each other. There are different multiple agendas within health systems, and somehow I think we need to be able to marry the social and political dimensions of health systems analysis with that more engineering and technocratic mindset, which, you know, is important. Don't get me wrong, I don't want to throw the baby out with the bathwater. But we sometimes see a kind of technocratic mindset being used to almost evade or deflect attention away from the more difficult social and political issues that touch on health systems.
Thank you. I'm cognizant of the fact that we are basically out of time, but I know there are more questions. So I'm going to ask my boss, Pascal, do we continue or do we close? Or do we ask one more question and then hand over to Claudia?
Can I suggest perhaps that we allow the presenters and the speakers a minute or two for their final interventions, and then hand over to Claudia.
Okay, so let's do that. Let's then start with the presenters. So 1 minute. Can we start from the beginning then? If you have any final thoughts, let's start with Aku. If you are, and then we'll move through the Davids and then through the panelists. So go ahead, Aku.
Thank you very much. A wonderful discussion. I just want to pick up on the point that David made and said that systems thinking, I think we can also change the metaphors that we use for systems thinking. So it doesn't always have to be a mechanical metaphor, but there are also biological systems, natural ecological systems, where that also gives us a language to understand or to describe the interactions. And I very much liked David Tan's point about the interfaces. One of the things that we have to, as systems thinkers, do a little bit more is find out how do we optimize those interactions as opposed to trying to continue to optimize the components. And so the power of systems thinking really relies on how we learn to see and describe the interactions and then make the interactions our points of interventions and not the components themselves. Thank you.
Thank you. Very, very valid point. David Mccoy?
Beyond what I've just talked about, that the social political dimension and these broader outputs and outcomes that we need to pay more attention to, I'd just like to go back to the kind of historical dimension and thinking again about how important it is to understand history. I'm a firm believer that you can't understand where you are now without knowing where you come from. And given the multiple challenges we face in terms of the future, whether it be COVID or the kind of ecological crisis, once again, I think that historical element, understanding how society is transitioned over time, is really important for being able to guide us in the future. Thanks.
Thank you again. A very valid point and important factor to bring in. David Tan.
I'll just pick off where David Mccoy left off. He talked about the importance of history for understanding the future. And absolutely, without a historical understanding of where we come from, we will not be able to construct good representations of system models that represent where we are now. When we have those systems models, as we look a lot toward futures thinking, foresight, anticipatory governance, how do we ground these futuristic approaches? Where are we going to get our trends from? Future trends, emerging trends, and not just the trends that we see today. And I think it is in that systems thinking and systems modeling space has a lot to offer this futures and foresight work.
Thank you, David. So again, about the context, putting what we want to do in the context of where we came from, basically. Can I ask Kabir and then Milo?
Thank you, Nima. In 2 words, I'd say people-centeredness. Systems thinking needs that additional lens of people-centeredness. I think that really draws for me on what David said on the political and social construction of systems and health systems, the fact that these are deeply embedded in political injustices, in inequities, and that there needs to be a conscious effort to overcome them. I think a focus on, we are always looking at that quest is for cross-systemic solutions. Now, a focus on solutions should not mean that it is just technocratic solutions. There must also be social, political, and systemic solutions. So that would be my takeaway.
Thank you. Milo?
Thank you, colleagues. Agreeing with all of that. Just to say that it's a complex problem that we're trying to solve. It spans climate, it spans health, it spans economy and incomes and people's well-being and livelihoods. It spans issues of consequences, inequality, for example. Looking forward, we need to get data-driven, we need to get anticipatory, we need to get really smart and intelligent as a species to figure out the interfaces and not just think in boxes, but more holistic and integrated system solutions, as you say. Over to you, Doctor.
Thank you. Pascal.
I want to take over then and loop towards the end, and thank you, Nima, and thank the panelists. But as a final comment, I really want to say just how proud I am to have been a part of this process. It has been amazing. Thank you to the panelists. Thank you to the contributors. Thank you to DG Tan Sri Hisham for his support in moving this forward, and hoping that this Malaysia experience will push other governments as well to be actively engaged in analytical processes within their health systems, and in terms of trying to make it all kind of work together and understand that it is a system. I have to say, up until those comments from the 2 Davids, I love the cover, but now all I see are cogs and wheels, and it's looking terribly mechanical to me. But it is very much about the system and recognizing that everything affects everything else. And for that, I think it's been an amazing journey and an amazing process. So thank you, everybody. I'll just hand over to my colleague, Claudia, for some final words, and we'll close the afternoon. Claudia.
Thank you, Pascal, and thank you also, Dr. Nima. So this session highlighted the value of the insights from the systems thinking analytical approach for health policy and system development, while also stressed the importance of the partnerships established between knowledge generators and commissioners. Through this process, we gained transferable lessons for policymakers and academic experts serving the Global South to build stronger health systems. We would like to reiterate that this methodology can be applied to study health systems in other countries. The United Nations University International Institute for Global Health is here to support researchers and policymakers to undertake interdisciplinary and intersectoral analysis of health systems using a systems thinking approach. We would like to thank all attendees for the questions posed and also the contributions of the distinguished speakers and the panelists. And in particular, we would also like to thank the participation of Director General of Health in Malaysia and our colleagues from WHO, the United Nations, and the Ministry of Health. And finally, we would like to invite you to fill in the event feedback questionnaire. I think we have the QR code in the slide, and the link is also in the chat. Thank you very much for participating in this event, and we wish you all a lovely week.
Bye. Thank you.
Thank you, everyone.
Thank you. Thank you, everybody.
Thank you. Bye.
Bye-bye.
Thank you. Bye-bye.